you have a problem?
I would like to read it for, is that mic? You, ready? All right. Welcome. My name is Michael Chance. I'm president of Florida Chiropractic Association. It is my honor this morning to welcome you to a very special event only held at the National Convention, the 2014 Plenary Session. I'd like to introduce Lou Sportelli. He's a Palmer 1962 graduate, has been in chiropractic over 50 years. President of NCMIC, that covers over 40,000 chiropractors in every chiropractic college. Written several books. His introduction to chiropractic I use in my office. I used to hand out to every patient when I would go on seminar, lectures. I would hand this out to prospective patients, Introduction to Chiropractic. On a personal note, Lou is always there for us. I had a bad article written on stroke in our paper this past spring. I called Lou up and he helped me put together a letter to the editor with the facts of the matter. He's always there for our profession. He does things that he doesn't even know that spread, and he plants the seeds for chiropractic. We have running an emerging leader conference in Florida next month for young leaders, and it was Lou and NCMIC that supplied the seed money for Iowa to start this program, and we're taking their program and having it run here in Florida. If in our profession we had a Mount Rushmore and we got to pick 4 of our modern leaders who should be on that Mount Rushmore, Lou Sportelli would definitely be one of them. Let's put your hands together and welcome Lou Sportelli.
Dr. Chance was the only one I didn't get a chance to talk to tell him to be brief, so please excuse that introduction. Ladies and gentlemen, first of all, welcome to the FCA convention. This Saturday morning has become rather special. Each year we have tried to make this program the conference event to attend, and if you will recall, last year we had a most entertaining speaker, one of the most prominent researchers in our profession, Dr. Greg Kawchuk. He left some of us with some incredible hope that the future of our profession is in capable hands. And this year, for our plenary, backed by popular demand, is Professor Marianne Jennings, who will make ethics come alive. And as you know, the first hour is our lightning rod, which I call our one-half TED Talks, delivered from our speakers within the profession, and I might want to also deliver a compliment to them because it's really tough to deliver something in 6 or 7 minutes that's succinct, but they've all stepped up to the plate, and they've all done a great job of condensing their conversations and their pearls into those short periods of time. And they've all been tremendous and respectful of the time constraints. Debbie always has a way of packing 2 hours into 50 minutes. So how they pack what they're doing in a short time is amazing, but you can hear more of their information because they're all speakers at one of their larger sections. However, this is the first year that we will be without one of our entertaining speakers up here on the podium. And I hope you will join me for a moment in a moment of silence for the passing of Dr. Michael Dobbins. Thank you. Michael was undoubtedly an incredible guy, as most of you who have heard him. And this year, to sort of commemorate that, I've provided each of our speakers with a book by Randy Pausch called The Last Lecture. If you haven't read it, as you know, that Carnegie Mellon had a a situation in which they said, if this were going to be your last lecture, what would you say? And Randy Pausch was his last lecture. And if you haven't seen it, go on Carnegie Mellon, listen to it. It's probably one of the most moving lectures you'll ever hear in your life. And so to kick off our first speaker this morning, we have Dr. Bruce Bond, and he's worked with thousands of unpredictable miracles over the last 3 decades. And Dr. Bond feels that the problem in America is not a lack of knowledge, it's a lack of application. And we as clinicians either start communicating in a way that touches at a heart that we will continue to see America dying too long and living too short. Dr. Bond.
Good morning. I found out at the last minute we were going to do a little thought about Michael, and Michael was a good friend and mentor and knew him quite well. In fact, shortly before he passed away, I did a radio show back in TV show back in New York, and we're 3 hours apart, and in the middle of the night, he sent me a text, and I was half asleep, and I figured I'd see him, down the road, and I never got to see him again. I never responded to that text, and I've always regretted that. So with that in mind, I'm just going to change up what I initially had thought was going to talk about, because I want to touch on something with that thought in mind. From practicing for over 30 years and dealing with thousands of patients, I've come to realize that, we can't tell patients how many years they have left, that we can necessarily add years to their life. What we started doing in practice was telling people, and we call them unpredictable miracles. We'd stop calling them patients because they are human beings that all have the same needs and have the same issues that we do. We started explaining to them or communicating with them instead of educating them that we're here to add life to your years. And as a chiropractor, I have found from treating thousands and thousands of patients that we have a gift, and that when we render that adjustment at the right time and the right purpose or with the right intent, that body can do remarkable things. But the thing that has changed, and Michael and I had talked about this over the years, what has changed over the years is that the bodies have changed. People today are more malnourished than ever before, and so we're doing the right form of care, we're just doing it on different bodies. So we started helping people feed their bodies at the cellular level. We rendered the adjustment, and then we let that innate intelligence or spirit or whatever you want to call it do what its will. But the problem in America is, the problem with the healthcare system in America is toward people dependency versus responsibility. And we need to teach people that their body, their health, their choices are their responsibility, that they get to choose what they eat, what they drink, and how they think. And from working with so many people over the years, I have found that knowledge does not equate with change. And I think you will agree with me if we did a poll now, if I polled you, you all know and Americans all know that they should be eating better and moving better. True? But they don't do it. And we as a profession, we have been putting out knowledge, and they probably won't invite me back after this, but here we go. We have been putting out knowledge after knowledge, but we still need to give them that information, but we need to change the way we deliver it. We need to communicate in a way that we touch people's hearts. I have learned over the years that I can't ask for a patient's hand until I touch their hearts. And you touch their hearts with their words, because if they keep making the wrong choices, they're going to continue going down the wrong path. Because every choice we teach people a principle, it's a principle of the path. Every choice puts people on the path. And every path has a predetermined destination. And it's inevitable that you're going to get to that destination. With our words, we have the ability to put people on a different path, because those choices aren't an event, they're in a direction. And when you make a choice to do something, that puts you in a certain direction. And if you just look at people today in America, we're pushing over 75% of obesity. That's not bad germs, bad genes, or bad luck. I mean, they come into our office and say, well, my mama has this, my papa has this, my beagle's overweight. And, they've been told it's in their genes, but it's all about the genes. But 95% of cancers are somatic. That means it's due to damage to the genes after birth. We tell patients, you didn't inherit bad genes, bad germs, or bad luck. You inherited bad habits. And the choices you make today are going to determine your destiny tomorrow. And what people don't understand is when they gain the weight, when they put the weight on, it's not about the scale. It's that these fat cells are actually organs, and they produce hormones. And they produce so many more of these hormones when people gain weight. And what happens is these small indiscretions, these wrong choices, not wrong, but these unwise choices made on a daily basis have a cumulative effect. It's the same thing, you know, health and wealth have one very common principle in common. You make the right monetary decisions on a daily basis. Over many years, you'll see the benefit. Same thing with the health choices. You make the wise choices. And that's called the compound effect, meaning that these small choices on a daily basis, which seem insignificant and which seem that they don't have much of an effect in a positive or negative way, but 5, 10, 15, 20 years do have a big effect on not only their health, but also their wealth. And it puts a burden on my heart when I see Americans making wrong choices. Not because they don't know, but because something in their heart hasn't compelled them to make that right choice. And we as chiropractors, look, there's over 300 million chiropractors in this country. But, I mean, 300 million people. There should be 300 million chiropractors in this country. But there are over 300 million people in this country, and only 80,000 of us plus that can find a subluxation at the right time and remove it with the right intent and right purpose. And that's a gift. And that is a gift, and we should be proud of it. And, you know, I roam these halls, and I hear great educational lectures, and I hear great talks of physiology, but I don't hear a lot of talk about that. And I have seen what the body is capable of doing. And if we as a profession just grasp this again, say, look, what we do works, but we have to change the way we deliver it. Communicate with these people, develop the skills to touch their hearts that causes them to change their behavior. So when you adjust them, that they're going to make the right food choices, that they're going to take the right supplements, that's going to help that chiropractic adjustment, that nerve energy make a difference in those cells. Because the quote was read to you before, and that actually, in July of 2000 of last year, there's a Wall Street Journal, and this is what it said: Americans are dying too long and living too short. Is that a fair statement? That's a fair statement. We have the best technology in the world, but we're here to add life to people's years. Look, I'm here on loan. I don't know when the note's going to get called. Michael, they called his note early, and I know where Michael's heart was, and I know where he is today, and he's in a good place. But our job is, at the end of our careers, all of us, at the end of our lives, all of us, it doesn't matter what we drove, what we wore, or what we said. We're going to get between the date of our birth and the date of our death, there's just a dash on that tombstone. And it is our purpose, the reason why we put on this planet, especially as chiropractors, is to make that dash stand for something. That make everybody's life that we come in contact, make it stand for something. That we can look back and say, you know what, through my words, and I'm fully convinced that we can take literally blind people, not in the literal sense, but you will agree with me, and you've had patients come in that were blind, but through your words, through your heart, that you can cause them to see the potential in their bodies and the potential that they have. And that's the burden that we share. But that's the burden we need to communicate to people. Knowledge does not equate with change. It doesn't equate with change. If knowledge did it, then everybody would be eating better, moving better, and thinking better. But we have a problem in this country, and it's costing people not only their health, it's costing them financially. Over 60% of bankruptcies in this country are due to people's inability to pay medical bills. We have a saying in our office: you neglect your health, you forfeit your wealth. Because Ralph Waldo Emerson said, your first wealth is your health. True? If you lose your health, you can't even create the wealth. You can't even give back. You know, granted, a lot of us are really successful, and part of the burden of being successful is making sure that we do well with what we've been given. You know, do well with the money, give it back, use our talents, use our services, use our communication skills. So I would just urge you, from my heart to your hearts, to everyone out there, you know that rule of the concentric circle? You help one person, that person's going to have an effect on their immediate family, their community, their town, the city, the state, the country. And that's what it's about. It's about, so when we pass, like Michael did, and I know Michael's dash stood for something, that your dash, my dash, stands for something. So I thank you for this brief time. Thank you.
Bruce, thank you. Michael will be proud. And by the way, for a commercial message, you know, all of these speakers are presented by a sponsor. They didn't just arrive here. Dr. Bond was presented by Standard Process. And our next speaker, Dr. Jay Greenstein, is the CEO of Sports and Spine Company. And he said, cut out the few seconds and just say, here's Jay.
All right, are we up here? All right, first of all, I really appreciate being here. It's great to be back, and I want to talk about my aha moment. So even though I sported a mullet back in the day, yeah, that's actually me with the mullet, my aha moments had literally nothing to do with this 80s band, okay? My aha moments actually had something to do with what was put out recently by this organization, the American Medical Association. Am I going to get any booze? Booze? No booze? Yeah, so from the American Medical Association. And recently, just this past July, they came out with an article entitled, New Opportunities in the Changing Landscape of Prevention. And here were some of their conclusions. Knowledge about effective prevention interventions for musculoskeletal diseases is limited even as their contribution to chronic disability increases. Another conclusion was that investing in prevention should be a strategic national priority to help improve the lagging population health of the United States compared with other countries. So prevention is the key word as we move through healthcare reform. The World Federation of Chiropractic definition states, chiropractic is a health profession concerned with the diagnosis, treatment, and prevention of mechanical disorders of the musculoskeletal system and the effects of these disorders on the function of the nervous system and general health. So my aha moment is really about the application of the scientific evidence, not just as it relates to treatment, but as it relates to injury prevention and maximizing performance. So every day in our practices, we're treating patients, we're giving the wonderful chiropractic adjustment, and we're treating conditions, but we're also providing maintenance care to help keep people healthy, prevention. And what's interesting is that in 2011, 2 papers came out actually supporting this on a scientific basis. In the Journal of the Occupational and Environmental Medicine, Cifuentes et al. Actually concluded that patients suffering nonspecific work-related low back pain who received health services mostly or mainly or only from a chiropractor had a lower risk of recurrent disability than the risk of any other provider type. We're talking about prevention. Doctors of chiropractic fit perfectly into this mold. Another study published in Spine by Senna et al. Actually stated that after the initial course of treatment, maintenance care was recommended. That's an amazing thing for us. But now, how do we take prevention to the next level? And it's all about other conditions, applying other scientific literature other than just spine care. So what's the rage these days? Concussion, right? And this is one of the reasons why. Video? Oh, hold on. Video? It always works at setup. All right, here we go.
Oh my God.
This is happening every day in our communities. Kids are getting concussed, and there's ways to actually prevent these things from occurring. Every year I attend the Youth Sports Safety Alliance Congress in Washington, D.C. This past year, Michael Broglio from the University of Michigan presented the new National Athletic Training Guidelines on concussion. And what do you think one of the recommended strategies were for prevention? Education. Educating parents, teachers, coaches, athletes on concussion. Now, just this weekend, the Foundation for Chiropractic Progress is actually putting on a program to help you understand how to educate the community on these issues. Very, very important. This is a prevention strategy. We need to be the leaders. In addition, Dr. Dawn Comstock, who has been studying youth concussion for a very long time, she reported that actually an increase in neck strength has been shown to decrease concussion rate. In her work, she demonstrated that actually for every 1 pound increase in strength, we could decrease concussion risk by 5%. Now, we're treating cervical spines in our practice all day long. We need to be applying the scientific evidence to reduce injury. So when you build an injury prevention program, first you need to establish the extent of the injuries, identify the risk factors and mechanisms of those injuries, introduce preventative measures, and then check your results. How do we do? The goals of an injury prevention program are very simple. You want to prevent or reduce the severity of these injuries, you want to change the risk factors, and you want total injury reduction. So here's my friend, Dr. Tim Tyler. He's one of the most well-known, recognized sports physical therapists in the world. He's team doctor for a high school football team. And what they were finding is they were getting tons of sprained ankles over and over and over again. So he just got sick of it, and he said, you know what, we need to fix this problem. So he first established a study to determine what the risk factors were for these kids. Well, to no surprise, previous ankle sprain was obviously a risk factor for future ankle sprain. That's been documented in the literature before. However, what wasn't documented was BMI. So the overweight athletes had a 19 times, not 19%, a 19 times greater risk of ankle sprains. So we can address those issues, certainly as it relates to diet and exercise, but in addition, we can also provide important musculoskeletal interventions based on the evidence that will have an impact on our community. So he gave the kids a bunch of stability trainers, and he had them train 5 minutes, both legs, 5 days a week in preseason, 2 days a week during the season, and he got a 77% reduction in ankle sprains. We need to be the leaders applying that scientific evidence to our communities to demonstrate we're the leaders and the cultural authority on prevention. This study was published in the American Journal of Sports Medicine. But what about maximizing performance, right? How do we get our patients to do superhuman feats like this guy? I mean, this guy's pretty incredible, right? I mean, the chiropractic adjustment is pretty awesome, right? Pretty awesome. And hopefully we can get our patients doing, you know, superhuman feats, right? Well, let's apply the evidence as it relates to performance. Now, this is another friend of mine, Dr. David Bain. He's probably the world's foremost leader on stretching and performance. He's a PhD at Memorial University in Newfoundland, and Dave has done some amazing work. And he and his team did a systematic review of the literature out there as it relates to stretching and performance. So what did he find? He found that stretching prior to an athletic event actually decreased performance. In fact, on average, athletic performance decreased, force and power decreased by 5%. So why is that relevant? Well, if you're Usain Bolt and if you're not Usain Bolt and you're trying to catch this guy, it's going to be pretty difficult, right? He's a pretty fast guy. He ran the 100 meters at the 2012 Olympics in 9.63 seconds. So what's this guy? This guy, he's 5% slower. He's Gerald Fury, 5% slower than Usain Bolt. Is that a big deal? Well, he ran it in 10.11 seconds. Where do you think Gerald finished? Did he finish in second? Did he get the silver? No. Did he finish in third and get the bronze? No. He finished 5% slower. He finished in 11th place in the semis. So 5% literally is the difference between celebrity and anonymity. So it's very, very important to our athletes, whether you're a world-class athlete or a weekend warrior, improving performance, and we had the opportunity to apply the literature and improving performance. We need to be the leaders doing that in our profession. He's also looked at the application of roller massages to performance as well, and what he found is that if you apply a roller massage to the athlete prior to performance, you can increase range of motion without the loss in any kind of contractile ability or activation of the muscle. Very, very important. And he looked at the same thing as it related to foam rollers, and he found the same results. So we can apply these interventions that are evidence-based, improve performance, and reduce injury, and we can be the leaders in applying that knowledge. So whether it's application of the scientific knowledge for the chiropractic adjustment, application of the knowledge to decrease injuries in a population, or application to improve human performance, doctors of chiropractic need to lead the way because we want to be the ones helping this young lady prevent a concussion, helping this young man reduce ankle sprains, and helping one of these guys run the race of their dreams. Thank you very much.
That's terrific. Thank you very much, Jay. That was great. The next speaker, I feel embarrassed to try to introduce him. If you don't know who Kent Greenwald is, you've been living in a cave somewhere. So I'm not going to give much of an introduction. I'm going to save his time. He's got a presentation called "When the Foot Hits the Butt, Everything Changes." I mean, when the foot hits the ground, everything changes. I'm sorry, Kent. Come on. Ladies and gentlemen, Kent Greenwald.
Well, with an intro like that, what can you say? Thank you, Dr. Sportelli. The topic that they gave us was to talk about an aha moment in clinical practice success. And I chose to talk about when the foot hits the ground, everything changes, because that simple concept is something that literally changed our world, affected millions of patients, and helped doctors have better outcomes. So I know it's early in the morning, but I'd like to ask you to do a very simple thing for me. If you'd just please stand up. I know maybe you haven't had your Starbucks, but let's do this. You can if you want to. You don't have to. All right. But
to do it.
But what I'd like to ask you to do is to stand with your feet shoulder width apart and put your fingers on the greater trochanter here. And I'd like to,
Can you help me find
and I'd like to have you rotate in and out, in and out. And as you do that, can you feel the movement in your greater trochanter? You say yes. All right, everybody take and turn to the left. And what is our right foot doing? It's pronating, correct?
Right.
What's our left foot doing? It's supinating. Everybody turn to the right. That's the other right, okay? The left foot is pronating. The right foot is supinating. Now let's try to cheat, chiropractic students, and we never do this, but let's just try. Put your hands back on the greater trochanter, and with the smallest microscopic tenth of a millimeter motion, slowly and oh so small, move your foot inside or outside. Just move it very little. Do you notice how the smallest you try it, you can still feel the greater trochanter move? Yes? Yeah, thank you. So, thank you. Thank you. The aha is going to go farther. Ooh, they did get rid of my time here. So, what we wanted to talk about is how the aha moment occurred. Once upon a time, there was a young chiropractor who became a chiropractor because of some bad news. What happened is he got some shots, was sent overseas to become part of our military force in World War II, and became paralyzed. Lived in an iron lung for 6 months, originally prayed to die, then prayed to live because the dying didn't work. And he said whatever helped him, he'd commit his life to. The mother was a very strong person. She said, I've had enough. They took him to a chiropractor. They carried him in. He walked out. He said, that's it, chiropractic. It was a miracle for him. This man was my father, and in his small practice in Dubuque, Iowa, in the basement of a bank, there was a podiatrist next door, and when they found a problem in the foot, he would refer to the podiatrist. Bottom line, they got worse. And he said, you know, I can't do this anymore because you're hurting my practice, but maybe there's something we could do on a positive sense that would help this happen. So through a lot of Thomas Edison type stuff, an invention occurred, and a result, the chiropractic adjustment could be more fortified, could possibly have better holding power, and give better outcomes. What he discovered is when the foot hits the ground, everything does change. It's just simple math. If you weigh 100 pounds, you basically put about 50 tons the mile on each foot. Here's a little slide that says if you weigh 165 pounds and you do a lot of running and that sort of thing, you can get up to 825 pounds of shock. Why do we care about that? All of us walk. All of us have occupations. Some have occupations like UPS that jump in and out of a truck all day. But when the foot hits the ground, everything does change, and that extra shock takes its toll on the musculoskeletal system. If you have arthritis, if you're overweight, if you have joint instability, lax ligaments problems, that can become a bigger problem. So the shock factor is important. Every time the foot hits the ground, everything changes. To illustrate it even more elementary, a basic law of biomechanics is that when you take a step, things happen, and they're supposed to happen within limits. This is like your tachometer in your car, that if you run it in the proper zone, the engine does fine. If you get it into the red zone and you have too much acceleration of your RPMs, you can cause problems. Same thing in your body. If you have too much acceleration, too much motion, then the compensatory change goes right up the musculoskeletal system, as in touching the greater trochanter, but with much greater effect. If we show this, and I show this slides at the chiropractic colleges, it's incorrect. There's something wrong with this. I usually tease the students and say we'll provide you a two-round class, first-class tickets to Hawaii if you can tell me what's wrong with this. Because Dr. Sportelli's here, I'll have him fund that. But he has way more money than I do. But does anybody, in looking at this diagram that's so simple, see something that's wrong with it? Jay, you have to be quiet. You can't tell. Do we see what's wrong? Maybe you can't see the slide that well. Well, in the center slide, we show a foot that's pronated because it's toed out, and it says functional LLI on it. And then you'll see an anatomical LLI where we had, some trauma or whatever that caused the deficiency. But the bottom line is that this should really look like this, because as we know biomechanically, the spine usually goes to the short leg side. So the lesson in this for the chiropractic students was, when you pronate, when your foot is toed out, that creates biomechanical changes up the kinetic change and these compensatory changes. And as a result, this spine, instead of being where it's supposed to be, actually creates what we call a functional scoliosis. And that's easy come, easy go, if you will, because if you look at this next slide that was done by my good friend Dr. Terry Yoakum, you can see a patient that has a differential in their femoral head height of 15.5 millimeters. And just the patient had the x-ray taken, and just a few moments after that, the patient was re-x-rayed. They stood on some orthotics, not to be named, and they stood on these orthotics, and as a result, the deficiency immediately changed from 15.5 to 4 millimeters. Does this happen with everybody? Well, of course not. But what it does attempt to show is to support the aha moment of that when the foot hits the ground, everything changes. And I think we could agree that when this person is lying on a chiropractic table and has had a very good adjustment, when they stand up, the foot changes. Everything changes when the foot hits the ground, and that's a little documentation on that for you. At National University of Health Sciences, there was a pilot study that was done a number of years ago, published in JMPT, that basically said that 44% reduction in pain within 6 weeks of use of orthotics. This was a very good study. And as a result, another one, an ongoing study, is going to follow that up, such is the way of research. And so what is happening is National University of Health Sciences in Lombard, Illinois, is collaborating with Rush University and the University of Illinois to do a 2.5-year-long study about chronic low back pain. They're using 225 different patients for this, and they are going to do a scientific evaluation that I think will be the most significant study that has ever been done on this area, and it should be done in a couple of years. Stay tuned. Believe me, we will tell you about the outcome when it happens. In addition to that, regarding research about how when the foot hits the ground, everything changes, and to support the aha moment with research, there's currently some ongoing research at New York Chiropractic College. They are also collaborating with the New York Veterans Administration System. It's a 3-year study with 220 patients, influencing to see how this affects biomechanics. So there's a lot going on there. To just show what happens when the foot hits the ground, everything changes. We took a patient and we had them stand in a casting kit. We filled it up with plaster. We had one where the foot was not on the ground, it was in the air, and we have the difference here. This is the same foot, the same person, literally about maybe 20 minutes apart, And as you can see, when the foot hits the ground, everything changes. Not only does that foot change, but so does the rest of the body. Thank you.
And I didn't have to use my foot to change anything either, Ken. That's good. That was brought to you by Foot Levelers, in case I failed to mention that, ladies and gentlemen. Our next speaker is brought to you by Biotics Research Corporation. It's Dr. Alex Vasquez. Alex is a Western States chiropractic graduate, went off to Bastyr University for his naturopathic degree, and if that wasn't enough, he went off to Texas College of Osteopathic Medicine for his osteopathic degree, and he's a prolific author and has multiple books out that can be purchased on Amazon without wasting too much time. Alex is going to talk about evidence-based clinical strategies that will inspire and illuminate your practice.
Is this the remote? Sorry. Okay. Good morning, everybody. So what I'll do in the next few minutes, 9 minutes to be exact, is go through a protocol that I found to be very helpful. And so my aha moment around this is, both as a clinician and as an educator, this new protocol that I've been working on for the last few years I found to be very efficient and easy to remember. So I think you may have access to these slides or the notes, and if you don't, you can certainly see me afterwards, and I can email them to you or something like that. I just want to make sure that you get the information in a way that's useful for you, and I'll try to make sure that I do that as we go through this information right now. So what I had been working on over the last 12 years was a protocol. I used to teach rheumatology, for example, and orthopedics at Bastyr, and over 14 years of working with this material and looking at the research, I started to notice patterns in the research that correlate with various different diseases, whether it's musculoskeletal pain, diabetes, hypertension, etc. And so then I started to organize these in a way that represented my clinical priorities. So, for example, and obviously we have to change priorities given each clinical situation, but I noticed that I was always talking about food with my patients and nutrition. A lot of times in the treatment of autoimmune and inflammatory conditions, I would look for these occult infections that will also be discussed later today. I would talk about nutrition for the immune system. Lately, I recently added dysfunctional mitochondria. Some of you heard me talk about that yesterday. That's relevant for migraine headaches, hypertension, diabetes, fibromyalgia. And then, of course, we all talk about stress, psychology, lifestyle, spinal health. That goes in the 5th category here. And then we look at hormonal imbalances and also detoxification needs and toxicity. So you can put that in an acronym that spells FIND-SET or FIND-SEX for easy memorization. And from there, I've been able to develop some more what I would consider to be advanced protocols for the treatment of various health conditions, whether it's musculoskeletal pain, diabetes, hypertension. So we'll look at that very briefly, and then I'll give you some examples of each. I'm sure you all learned in school to go through some sort of protocol like SOAP, for example, Subjective Objective Assessment and Plan. So this just extends that to help us all remember some of the more important things that we need to include in our treatment plans. Again, this applies broadly to lots of patients, but especially patients with inflammatory musculoskeletal conditions like rheumatoid arthritis, ankylosing spondylitis, things like that. Again, looking at food, the occult infections that these patients often have, nutrition for the immune system, dysfunctional mitochondria again, stress, lifestyle, psychology, spinal health, endocrine imbalances, and toxicity. These are some guidelines that I published in terms of just basic nutritional supplementation, paleo diet, multivitamin, multimineral, vitamin D. Lots of your patients are vitamin D deficient. When they are vitamin D deficient, they have more musculoskeletal pain and inflammation. They also have more depression, hypertension, and diabetes. So giving patients vitamin D is something very simple that you can do, and it provides many, many benefits. Same would be true for combination fatty acids. A lot of patients are fatty acid deficient. When we give them fatty acids, it reduces inflammation and pain. In fact, one article was published just a few years ago showing it was very effective for low back pain as well. Obviously, you can do that with your chiropractic modalities as well. I published that as a review article through the American Chiropractic Association. A lot of our patients eat too much fast food. 20% of the food eaten in America is fast food. It obviously contains too much sugar, salt, and fat, and that promotes more inflammation, as was demonstrated here. That pro-inflammatory effect of diet lasts for about 2 to 3 hours after people eat bad food. So for people who are eating bad food 2 to 3 times per day, they're promoting inflammation in their body for up to 12 hours per day just by the food that they eat. When we put patients on a low-carbohydrate diet, we can reduce inflammation by about 50%, according to this article published in JAMA. When we give them vitamin D, we can reduce their inflammation by 23%, according to this article. And vitamin D is, again, proven to have many benefits. It's very safe and effective. We can use daily supplementation in the form of a liquid drop, for example. It's very convenient for kids. It avoids any risk of choking, obviously. In this study, patients were given a multivitamin, and it showed a 14% reduction in the inflammatory marker C-reactive protein. So again, you can get a great anti-inflammatory effect just with simple nutritional interventions. I mentioned looking for and dealing with some of these occult infections. Again, it's very important in patients who have autoimmune disease, but it doesn't mean you have to put patients on an antibiotic, and it doesn't necessarily mean that I'm even advocating that. One of the things we can do to help these patients who have these chronic infections is to restore the function of the immune system, again, by using nutrition. For example, vitamin D is necessary for the production of certain proteins that are called antimicrobial peptides. And that's basically the body's natural antibiotic. Those kill viruses, bacteria, and fungi, and cancer cells. Again, they're called antimicrobial peptides, and vitamin D is necessary for their production. So when we talk about treating these chronic occult infections, it doesn't necessarily mean using drugs. It could simply mean restoring proper immune function with diet, lifestyle, exercise, and nutrition. Here again is another article that I published through the American Chiropractic Association's Council on Nutrition. You can download this from my website. If that's too cumbersome, I'm happy to email the article to you. One of the agents you can use in your clinical practice would be oregano oil, for example. It's been shown to help get rid of some of the unfavorable or harmful bacteria and parasites that can live in the gastrointestinal tract. And in this article, 600 milligrams was used for 6 weeks, and it showed complete safety and high effectiveness against various different gastrointestinal parasites. It's obviously a non-prescription item that you can use. Some of you may have seen yesterday in one of my presentations, I talked about changing the function of the immune system through nutritional supplementation. The main nutrients that we use there are vitamin A, vitamin D, things like green tea and lipoic acid as well. And that's already been proven to be effective in adults. It's not something that has to either happen or not happen during infancy. It's something that we can do in adults, and we can get those results within about 1 month. This is the complete recipe. Whenever I have a long list of items like this in part of the treatment plan, I always make an acronym for it. In this case, the acronym is My Best Plaid Fig. I realize that's very cumbersome, but it works for this. That stands for mitochondrial optimization, biotin supplementation, vitamin E, avoiding sodium and GMO transgenic foods, using probiotic supplementation, lipoic acid, vitamin A, again addressing inflammation and infections, vitamin D, fatty acids, and finishing up with green tea. All of those have been shown to rebalance the immune system in a way that prevents autoimmune conditions, and it's been documented in diabetes, multiple sclerosis, lupus, for example, as well as hypertension. Mitochondrial dysfunction is something that you're seeing in your office on a regular basis when you deal with patients who have migraine headaches, diabetes, hypertension. And again, this is something that you can address. I published an article earlier this year in Alternative Therapies in Health and Medicine. You can download that article from the internet for free. And it talks about the importance of looking for and addressing mitochondrial dysfunction in our patients. Again, especially migraine headaches and fibromyalgia. I'm sure you're all seeing that. So some simple things you can do for mitochondrial health are to use nutrients like coenzyme Q10, 100 milligrams per day, lipoic acid, maybe 800 milligrams per day, and L-carnitine, 1 to 4 grams per day, so let's say 2 grams per day. That's all been shown to be very safe and effective for improving mitochondrial health. I'll pass over that one, and I think I'll only briefly mention this one. Similar to mitochondrial dysfunction, in the next few years you're going to hear a term called endoplasmic reticulum stress, very similar to mitochondrial dysfunction. So, in finishing up, I just want to emphasize, of course, stress reduction, spinal health, spinal adjusting, and also extremity adjusting. A lot of our patients have hormonal imbalances. A lot of times we can correct those using non-pharmaceutical means just by diet and lifestyle, especially weight loss. As was mentioned earlier, fat is actually an endocrine organ, and it promotes inflammation. We, of course, need to promote detoxification in our patients, and we can do that with proper nutrition. I appreciate your attention. Thank you very much.
Our next speaker, Dr. Bill Kleber, is sponsored by the DABCI program, the Internal Medicine Diplomate program. He received his Doctor of Chiropractic degree in New York Chiropractic College in 1982, earned his Diplomate degree from the American Board of Chiropractic Internists in 2000. He's in the unique position of utilizing advanced diagnostic methods to uncover the source of illness and then treat the holistic and natural supplements to correct the illness. With more than 29 years of experience as a chiropractor and 11 years as an internist, he brings us a successful practice from Colorado and will share some pearls this morning. Bill.
Thank you very much, Dr. Sportelli. Thank you. Thank you very much, Dr. Sportelli. I'd like to thank the Florida Chiropractic Association for inviting me to the plenary session, and of course Biotics Research for sponsoring the detoxification program that we're putting on here this weekend as part of the DABC program. Well, I guess that, Alex, I'd also like to thank you for a real nice segue into the infection connection, which was my aha moment. When you realize you had an aha moment, I mean, I don't think that the people up here on the dais are the only people in this room that have had aha moments. I'm sure we all have had aha moments. But having an aha moment is, first of all, realizing you're having an aha moment and then trusting your instincts. When you finally realize that aha moment is something about what you do every day, but you finally look at it in a different manner and you act upon it, that's really what it's about. I've been talking about thyroid function for a long time, and one of my mantras has always been, manage the thyroid and treat the patient. You're not treating the thyroid in most instances. I've come to realize that the vast majority, in my clinical experience, I'd say 90% of the patients who have hypothyroidism have an autoimmune situation. We tend to treat the wrong things in this country. We tend to treat the thyroid when it's not the thyroid, it's the immune system. We tend to treat the joint, in the case of rheumatoid arthritis, with powerful immunosuppressant medications when it's not really the joint's problem, it's the immune system's problem. Of course, the signs and symptoms of hypothyroidism, many of your patients have these things: an enlarged thyroid, an intolerance to cold, tiredness and the need to sleep excessively, constipation, increased menstrual flow. You're familiar with many of those things, dry skin, and even things like depression with psychological changes. And so many patients are told that they're okay and that they really don't have a problem because basically not us, but the profession, the healthcare profession in general, has done a terrible job of diagnosing and treating autoimmune diseases, and particularly thyroid diseases. You can see from this cartoon, well, I'm happy to run some tests for you, but to be honest, I think it's all in your head. I believe my patients when they come in and they're telling me that they actually have a lot of the symptoms that we just talked about. I'm going to build up here to my aha moment and explain a little bit about the central regulation of the thyroid. So it starts off with the hypothalamus detecting the amount of thyroid hormone in the blood. Let's say, for example, the thyroid hormone in the blood is a little bit low. The hypothalamus detects it. It sends a message, a hormonal message to the pituitary called thytrophin-releasing hormone. And that says to the pituitary, hey, I want you to release the hormone in a certain proportion to the amount of stimulation it just got from the pituitary, and that's supposed to satisfy the hypothalamus. The hypothalamus stops bugging the pituitary, and the pituitary drops its secretion of TSH to between 0.4 and 4.5, and then everything's supposed to be just dandy. Well, I think that in many instances what you're going to find is that they don't communicate very well. So the bottom line is when thyroid hormone is low, TSH is supposed to be high. In many instances, that's not true. We have poor testing, generally poor quality testing if you're only looking at TSH. We also advocate testing the free T3, the free T4, and looking for autoimmunity within the thyroid gland itself by testing the antithyroglobulin and the antithyroid peroxidase antibodies. 2 women were walking down the street, and a talking frog said, "Kiss me, and I'll turn into an endocrinologist." One of the women scooped up the frog and put him in her shopping bag. The other woman said, "Aren't you going to kiss him?" Her friend replied, "Hell no. A talking frog will talk to me more than my endocrinologist." Taking good care of your patients is about explaining things to them so that they're part of the care. My aha moment came when a patient came into me, and I saw her. She was sitting in the lab. Our medical assistant was drawing her blood on Monday. She came into me on Wednesday, and I remember exactly where she sat, and I looked at her, and she had been under my care for quite a while, and she had a horrible cold. And I said to her, "Did you have a horrible cold on Monday? I mean, either that or you were certainly going to get it." And she was here for her, 6-month checkup. And she had been doing really well. Well, her TSH was 24. And I said, "There's something wrong here." I said, "Here's what I want you to do." And this was my aha moment. Actually, I had 2 aha moments. I realized I had an aha moment. And then I said, "Aha, I just had an aha moment." So I had multiple aha moments. So I gave myself a couple of minutes to bask in the glory of those aha moments. And I said, "This is what I want you to do. I want you to go home. Here's some stuff for your flu. I want you to come back in 3 weeks. We'll redraw the blood, and we won't charge you anything. It's on us." And we redrew the blood without changing any of the thyroid hormone supplementation we had her on, or thyroid hormone. And you know what? It came on. It came back right on. Exactly accurate. Doctors, we have in our country an infection connection to all of these autoimmune issues, the chronic low-grade infections that we have. My aha moment is now my medical assistant or anybody else in our office knows that we're not going to draw blood on any hypothyroid patient who has autoimmune disease if they're ill with obvious symptoms. Because in Hashimoto's disease, that immune issue, the low-grade or the high-grade infection upregulates that immune response, and these white blood cells called T lymphocytes, they attack the thyroid. It drops down the thyroid hormone level, and it raises the TSH. I see this in my practice all the time. That was a really high-level infection that this person had. But what about the patients in your clinic who have these low-level infections? I changed the definition of infection. I like to say, we like to think of infection as green and yellow mucus and pus. And that is an infection, but there's a lot of other things that are infections. I like to say that whatever upregulates the immune system's response is a type of an infection. I get some flack from the doctors in the DABC program saying I've made up the Kleber definition. And if that be so, that's fine, because I like that they're paying attention and they get what I'm saying. There could be too much of something that's not supposed to be there, and that's an infection, or not enough of something that's supposed to be there. And the immune system isn't fooled. It gets all stirred up. It gets its bowels in an uproar. Heavy metals, autoimmune stimulators, xenobiotics, things that aren't supposed to be in the body, or things that are in the body in a disproportionate amount to what they're supposed to be in there. There's a lot of different infections in your patient's bodies. Sinus issues, vaginal yeast, anything that ends in itis, so cervicitis, gingivitis, intestinal dysbiosis, colitis, interstitial cystitis, prostatitis, dermatitis, bronchitis, tonsillitis, Epstein-Barr viral infections, fungal infections, parasitic infections. People are used to saying, well, I've always had these low-grade infections and I'm used to it. But you have to find out where they are and downregulate those low-grade infections. That was part of my aha moment. The initial result to inflammation is due to inflammatory proteins that are the communicating mechanisms of the immune system called cytokines. And doctors who are treating musculoskeletal things, you have a lot of patients who have a lot of inflammation in their body due to these chronic low-grade infections, and we have to get rid of them. Consider the source, do a thorough case history, and fix the problem through diet, food allergy testing, environmental influences, remove the offending foods, the toxins, repair the damaged intestinal lining, restore the optimum intestinal flora, and things like replace with necessary things like digestive enzymes, bile salts, hydrochloric acid. Get rid of these chronic low-grade infections in your patients. And you know what? Doctors, next time you have an aha moment, take your time and believe in yourself and follow that aha moment through. It was said by Charles Bukowski, the author, the problem with the world is that the intelligent people are full of doubt while the stupid people are full of confidence. So go on out there, believe in yourself, trust your instincts, and have as many multiple aha moments as your wife will let you or your husband will let you. Thank you very much, and I appreciate your time.
Thank you, Bill. Ladies and gentlemen, how about a nice round of applause for our speakers this morning? I'm going to, you guys stand up and you're going to be, and this is the, if you will, this side here for you guys. Alex, is there steps down there? Oh, here, there's some steps down here. All except you, Kent, you have an introduction moment here. Yeah, Kent's going to introduce, right? Here he is again. I'm saving time, man. I'm saving time.
Thank you for that motivation, wonderful introduction, Dr. Sportelli. Yeah, me too. Okay. 10 years ago, the Foundation for Chiropractic Progress was born, and just like a baby, organizations grow, and sometimes they get sick, and sometimes they have episodes of good health, and then they go through adolescence, etc., and become an adult. In this 10 years, I think we've grown pretty quickly. We can back that up with evidence. The past couple of years, we have had over 31 billion positive responses to our positive press campaign. That's 31 billion. It's not the national debt, but you know, it's a pretty good number. In this process, we have created 20 new ads that are going to be available to the members of the foundation. Why is this important? Because we believe that through positive press, that's a way to move the needle to try to get people, patients, into the individual doctor's office. One of the latest things that we're doing in all of our advertising, whether it's the Wall Street Journal, the USA Today, or other media, is that we've recently created something that we think is very exciting called a directory. So now when the ad is in the Wall Street Journal, or wherever you happen to read it, there will be a tagline that says, "Find a local doctor." And we're now in the process of uploading and have uploaded many, many thousands of chiropractors around the country, so when they see that ad, they know what to do. It's a really nice thing that I think is going to help the local practitioner. In addition to all this directory and the ads and that sort of thing, as Dr. Greenstein said earlier, we have a program right now here at the Florida Chiropractic Association meeting called TIPS. TIPS is specifically designed to make the local doctor a star, to help them get out into the community and get more people to see them. We have just have a relationship currently with the American Youth Soccer League that has over 500,000 members. That's 500,000 members. And frankly, we need you to help educate them. There's no way with the current amount of doctors we have certified that we can handle the demands that are going to be placed upon us. Thus, these meetings that we're having here. I want to talk for a moment about Recommend One, and then I'm going to introduce a very special person. Recommend One is a concept that was developed by Joe Doyle, and Joe, I don't know, are you here? Joe Doyle's on our board. Stand up, Joe. Do I see you? Okay, thank you. Joe Doyle's on our board. He owns Chiropractic Economics. He has given thousands and thousands of dollars to the foundation and helped us get our message out. But he had the idea that if you just asked the chiropractor to recommend one, that we would be in a very favorable position. So the ACC, ICA, COXA, NBCE, the ACA are all in. It's an inclusive organization. We're recruiting vendors, associations, doctors, colleges. The bottom line is that we want to make an effort to have all these doctors recommend one. Chiroeconomic research that Joe spearheaded showed that approximately 70% of the people out there in the field would recommend one patient, and he also found out that they would even recommend to a school that they didn't go to. The point is the doctors were in. 7 out of 10 said they would do this. We're going to provide posters, multimedia, notepads, etc. Lots of nice things for the doctor in their office to do. But as you all know, any organization needs a leader, a spokesperson, someone with proven performance that can get a job done and communicate. And we are truly blessed to have General Becky Halstead on our team. She has proven many times within this profession, with outside the profession, and around the world, her leadership capabilities and what can happen with her motivation. Becky, would you please come up and talk a little bit about Recommend One?
Good morning. So I'm really glad that Kent, you asked me to do this, and on behalf of the foundation, and they gave you a little bit of an overview of Recommend One. So I'm going to keep it very simple. Why me? Why you? And why them? And the them being future folks to be chiropractic students, then to be chiropractors, and continue to help patients like me. And so let me talk about why me. So if you haven't met me in the last couple of years, I'll kind of quote Dr. Bond. You have given me life back in my years. You have improved my quality of life. In the military, 27 years, retired because I was ill with chronic fibromyalgia. Met Dr. Carol Ann Malizia. She says, you don't have to live in chronic pain. I said, great, who are you and what do you do? And so I knew about chiropractic, but I was not a full-time patient of chiropractic, not available in the military. So she took me under her wing when I retired, changed my life, gave me the quality of my life back. Then I met Kent, who said, Becky, would you tell your story? Would you be part of the foundation and be a spokesperson? And I said, absolutely, because it's a story that must be told. These aha moments up here that were so eloquently done in 9 minutes or less, you all have a story. You all have aha moments. You all should be thinking right now, why did I become a chiropractor? Who else have I told about chiropractic? So I'm a satisfied patient. And anytime I talk to people, I usually find out, how they're doing, what they're doing. And it always comes up as health, always, or the lack thereof. And I'll say, well, have you ever seen a chiropractor about that? No, what's a chiropractor? If they're younger, I might say, a lot of people looking for a job, what to do for a career. Have you ever thought about chiropractic? Especially those in our military who understand the need to have great health. And so when I was asked to, I'm going to do the slide. Am I going to do the slide? I hope I do the slide. About Recommend One, I said, well, I'd be happy to do that. Because as a satisfied patient, I want more than ever for this profession to grow. And I want to grow for all the right reasons. Not necessarily to put money in your pockets as chiropractors, but to bring better health to a nation that needs it. So I always say chiropractic is about the patient, because my expertise is leadership. Leadership is not about the leader, it's about the led, those you lead. It's about your patients. So a survey was done by Chiro Economics. You can see a couple bullets up here, kind of some interesting statistics in terms of how many chiropractors said that they recommend chiropractic to others. They recommend the chiropractic profession to others, I should say. Did they actually recommend their own college that their alum, that they were an alum to? There's another statistic, 2 more statistics here for you. Well, let's do our own survey, because I don't know how many of you took the Chiro Economics survey. So just with a raise of hands, how many of you have ever recommended the chiropractic profession to someone else? Well, that looks about 100% to me. So either more people need to take the survey. No, I'm just kidding. But that's excellent. But here's what I would ask you. Why? Why have you recommended the chiropractic profession to others? See, I've recommended military to many people, not necessarily to all, because not all people are meant for the military. But when I look at your profession and I see the talent that you have, I see the compassion that you have, I see how you bring the patient in, how you allow us to be part of the solution, that's fascinating. And when I talk to a lot of students, because I've gone to almost all the colleges, thank you to the presidents who have invited me and allowed me to talk on leadership and my story, I ask students, my favorite question is, why did you choose chiropractic? No different than when I was a general in the military. Why did you choose to serve in the military? I want to know your story. And almost to a dime, it was either because they were part of a legacy, their mom, their dad, their aunt or uncle, a brother or sister were chiropractors, or they were a patient, or maybe they were a patient and their life was changed. Like Kent's father, life was changed, dedicated to changing other lives. Pretty neat. So see, when I think about you recruiting for chiropractic, I would like to put the title of your legacy builders. You ought to be passionate about your profession. You ought to be serving every day so that people will be touched and they'll go, oh my gosh, if I could do it, you could do. Well, you can. Here's how you do it. So there's a great website down the very corner of this, but you can come by booth 34 and get some more information, some more tools that we have for you. But there's a great website. I believe the ACC created the website, where if you find someone who's interested or you recommend them, they can go there and they can start to look at all the different schools, which I love the fact that you have that, because I like pointing people in the right direction and then let them then start to hunt for it themselves. So one of the things that the Recommend One has done is they want to honor people. So why you? I've already kind of hit on a little bit on that. Why you? Because it's your profession. You ought to be passionate about it, and you want to create a legacy, because you can't be here forever doing it. And then why you, in terms of really make a conscious effort to talk about it, to share it. And so one of the pieces of Recommend One is that we want to, the schools have identified some of their top chiropractors who have been out recruiting, because they've gone and talked to the students, why are you here? Well, Dr. You name it, told me about chiropractic, and that's why I'm here. So I have a list of names that I've been asked to read, and the college associated with that. If you're here, I know at least the first one is here. If you're present, we would like you to stand. Please hold your applause to the very end. I know many could not be here, but I think it brings great visibility to the schools and to those doctors who are out there making a difference. See, that's what I want to end on, is you need to make a difference. It's great to be successful, but how about let's be significant? Let's be significant. Let's have purpose in our life, and let's make a difference. So here's the doctors. First one is one of my favorites, Dr. Carol Ann Malizia from New York Chiropractic College. Dr. Scott, some of you are listening. Well done, my doc who got me into all this. Dr. Scott Phillips from Parker, Dr. Tracy Wilson from Parker, Dr. Daniel Warner from Palmer, Dr. Sawyer Kaya from Palmer, Dr. Blake Upston from Palmer, Dr. Joe Lupo from Life, Dr. Anthony Wolf from Logan, Dr. Paul Phipps from Logan, Dr. Devin Varana from Cleveland, Dr. Jake Akerson from Cleveland, Dr. Michael Hamler from Cleveland, Dr. Michael Perush from Cleveland, Dr. Andrew Harding from Cleveland, Dr. Jamie Gaywith from Cleveland, Dr. Stephen Chapman from Cleveland, Dr. Alan Dabbs from Cleveland, Dr. Darrell Rhodes from Cleveland. Well done, Cleveland. Dr. Carrie Kaiser from Life West, Dr. Ron Oberstein, Life West, Dr. Mark Dietrich from Los Angeles and Dr. Tim Noble from Los Angeles. So please, let's just give a round of applause for all those doctors. I have the disadvantage that I'm very short, so I have no idea how much time I had left. Should have raised that up, shouldn't we, for us short people? Well, they should listen to you. More people should listen to you. So 2 minutes left. So what we would invite you to do, there's going to be flyers in the back of the room. And as you depart, pick one up. We're at booth number 34, the foundation. If you missed it, because I was talking kind of fast, every single doctor sitting in this room has a story. Tell your story. That's what people remember, is they remember our stories. And connect. I believe you heard it up here. You can have all the knowledge in the world, but if you don't apply it, what good does it do? Share it, apply it, and when you communicate, you want to connect. So I'll be by the booth up until about noon today, maybe closer to 1. Would love to hear your story. Reach out to your patients. You're going to connect with them anyhow because you're helping them find a better version of themselves with their health journey. But share to them why it's so important to you. I used to sit at the feet of my grandfather and listen to his stories about his life, and it changed me. It changed me. It made me who I am and why I do the things I do. So don't hesitate. It's not in a boasting way. It's a love for people, and it's a passion for what you do. And I think that you would find that you will recruit many more people to want to join the profession that you're in and make a difference. So I thank you for your time. Thanks for letting me be part of it. Kent?
Thank you, General Halstead. Ladies and gentlemen, we have a few more speakers before we're finished, so please stay where you are. Dr. Chance?
Our next speaker is Brad Cost. Brad is the president of Infinity, and Infinity is the national clearinghouse located in Tulsa, Oklahoma. They have over 17,000 practitioners in all 50 states, and they process over 3 million claims every month. Infinity has been an analytical company who has been helping state associations and the American Chiropractic Association as a partner in getting the data that we need to show how chiropractic works and how we can use it in our practice. Dr. Cost, Brad Cost used to be the faculty as a senior faculty member at the University of Oklahoma State. He's now at Infinity. We'd like to have Brad come up and speak. Thanks.
Good morning. I want to thank you for the opportunity to be here to speak, and I've listened to all these great doctors over the last hour talk about the physiology of the human body. So for a moment, I've got to get you to sort of change and shift over to the business side, because that's what I'm here to talk about. There's been a battle that's been going on for decades against chiropractic. The reimbursement of chiropractics has been terrible. There have been a few soldiers out there fighting that battle. And today, I can best tell it by starting out with a story, if I can get my slides to change. The story of Ned. Ned was a young man that was very anti-technology, hated technology, sort of like Robin and the Merry Men would go out and destroy things. Ned was known and over history has been made sort of an icon because of his stances against technology. One of the reasons that I use the story about Ned today is the fact that Ned was wrong. Technology is a good thing. Ned existed in 1799. Ned was against the spinning frames in the beginning of the Industrial Revolution. Think of what the world would be like today if simple things like the spinning frame and the power loom would not have come into existence. Ned was wrong about technology. And today, most people have that same fear of technology, but yet we pull out our cell phones. We get onto Facebook. Yesterday in my class, I had a gentleman sitting in the front row that had Google glasses on that was recording everything that was said, and probably within an hour, that whole session was broken down, uploaded to Google, YouTube. Technology is with us today, and it's very important that we embrace that, because all of these great things that we're doing today to help patients may be very harmed in the future because we will not have access to those patients. What is the future of healthcare and EDI going to be like? Electronic data interchange. We've got to build on the technology as we move forward. And again, technology is one of those things that most people don't understand. One of my aha moments was in a class that I was teaching a few months ago, and I took a poll of class members of how many people were submitting claims simply electronically or on paper. 80% of the people in the class still transmitted their claims on paper. Once a claim is on paper and doesn't go electronic, that data is almost completely lost. And today, HIPAA even requires us to use ANSI standards to transmit claims. Why are we so afraid of big data? That term big data maybe is scary. But big data is simply de-identified large volume sets of information that are both specific and regional. They're being used against you today by the payers. Payers are profiling you, putting you in lower categories than they should be, limiting your access to patients. I say that data can empower you. It can resolve individual patient health problems by understanding in a bigger way, in a bigger region. Big data can give you access to experience in the medical profession that you can't get in any other way. Just look at the political direction of how data is happening now, how you're being profiled. In the federal government, we have Affordable Care Act. Think how medicine has changed just in the last 6 years of how you're recognized. I don't know whether that's a positive thing or a negative thing, but it looks like the winds that the doctors are losing out in all specialties, not just chiropractic. Accountable care organizations really are going to be used to measure, data is going to be used to measure your performance in your placement of that accountable care organization, or if you can even get into that accountable care organization. The same thing with exchanges. Even our state and local governments and Medicaid, third-party payers, legislation, personal injury, the payers are looking at the data that you're producing through your claims. And it can be skewed because not everyone is using and contributing to that data. You have great organizations, national chiropractic organizations like the ACA, that have started taking place to understand that they need that data from you as an individual provider to make determinations for more focused issues, to make better representations in class action suits so that we can talk about better reimbursement for you. The same thing with state organizations such as the FCA. They're looking at that data for personal injury lawsuits, lobbying efforts, payer audits, and educational efforts. One of those main ways to get claims information and data into the system is through a claims clearinghouse from your practice management system. It's one of the simplest ways. It's a very efficient model of getting the information because of the rapid processing. It's a way that you can submit all of your claims instantly electronically. It eliminates the problem of keying information of a claim. Many times that data is used in analytical purpose for utilization management, for profiling that is used for business performance, for business determinations. Even in your own practice, you can use that information to understand your patients better, to understand your business model better than what you ever have before. But one of the big things that I want to talk about, one of the big aha moments is there's usually a person in between us and the payer, and that's an intermediary. Today, as you'll see by the pie chart, in most of the intermediary methodologies, the intermediary has taken a huge piece of that pie, and it leaves much less of the pie to distribute out in reimbursements. I say there's a better way. Today, there's a structure called an association to own IPA that is an organization of your peers, your state people that have come together and found the methodology to take that pie and remove the administration costs down to a very small sliver of that pie, thus making a much bigger pie available for you as a provider in reimbursement. The association-owned ones are peer-reviewed. It's your own doctor sitting on that association, helping you understand the evidence of medicine. The utilization management determinations are done in a pro-advocate way because it is your peers in this association. The troublesome problems of like all of the phone calls for authorization and this kind of methodology goes completely away. So you're more efficient. You have more time to spend seeing your patient, using these wonderful technologies to help the patient. And in the end, the bottom line, it all brings higher reimbursements into our pockets. Guys, I'm going to give you a number. At 10:10 today, in this right room, an announcement's going to be made that could change your life. It is a battle that needs to be fought. It is a battle that every one of you need to take hold of for the future of chiropractic. Not just your future, but your children's future that are going to go into chiropractic, your grandchildren's future that are going to go into chiropractic. If that battle is not won, chiropractic could go away in a big way. You've got to stand up and fight for this because for the last several decades, you've not fought for this issue. As the ad's going to show, a new day is dawning. The Florida Chiropractic Association has gotten together and found the right partners, the right moment, and the right time to change the world for chiropractic. And you've got to be a part of that. Be here at 10:10, hear that announcement, and thank you very much for your time.
Ladies and gentlemen, you've heard, thank you very much. You've heard the clinical piece, the clinical pearls in the morning. We've heard some business aspect just recently. And now we're in for a moment of motivation from Dr. Fab Mancini, who was president of Parker College, also has left Parker College and is now going on the motivational circuit. And the thing I like most about Fab is he makes English sound romantic. Fab?
Thank you, Lou. And you know what's interesting is that I was invited. We had our first graduation in the new chiropractic college in Spain, in Madrid. I don't know if you're familiar with that. And I was asked to be the commencement speaker. And they actually introduced me as the Antonio Banderas of chiropractic. So I think this accent is actually paying off. But let's give a round of applause for FCA for putting all this together because honestly, I'm extremely impressed and honored to be here. So I want to share with you a couple of aha moments because that's the topic of this morning. And for me, my first aha moment was the fact that I was rear-ended when I was going through pre-med school and led me to an orthopedic doctor that referred me to his chiropractor. It changed my life. It was my first aha moment in chiropractic. I was able to be in an environment that taught me that health is an inside process, that the body has the ability to heal itself naturally, that the nervous system is a master system and controls and regulates all the other systems. The fact that we had a universal intelligence and an innate intelligence in our bodies that actually work every single day, even when we don't work. And that allows us to be healthy and have a healthy lifestyle. Well, that moment led me into interviewing 62 chiropractors over a period of 6 months, and I chose to become a chiropractor instead of a medical doctor. Changed my life. Then, of course, I go into chiropractic school, And I'm so excited because I'm discovering a whole new world, a world that is really emphasizing a new paradigm, a new way of thinking, and something that was not familiar to me before, but something that I could tell that it was very much needed in the world. And as I went through school, I had an interesting experience. My second patient, an internship, right? So I become an intern. My second patient is a lady that had rheumatoid arthritis for 27 years. I went to my staff doctor and I said, listen, is it okay for me to take care of this patient? And I said, well, Fab, we taught you that we want to make sure that we serve as many people as we can. And I said, well, I'd like to call her MD just to make sure that I understand her history. I picked up the phone, I called her MD, and the MD says to me, well, I was the one that referred him to you because there's nothing else we can do for her. I've had other patients that have benefited from chiropractic care, and I believe in chiropractic. I began working with this young lady. She was actually 57 years old. She had a florist shop, and she loved her florist shop. That was her dream in life, is to actually put together flower arrangements. But she developed this arthritis to the point that she couldn't do it anymore. She came in with her hands and fingers just like this. And she said to me, can you help me? And I said, well, I don't know, but let's just see what the body can do. Well, within a period of time, she began to get better and get better. About 3 months later, she says to me, well, Dr. Fab, I just came back from my doctor, and for the first time in 27 years, my blood work says that my RA factor is negative. Thank you so much. Not only did she regain her movement through chiropractic care, she became a massage therapist, and her daughter became a chiropractor because of her experience. I'm sharing you these stories because I want you to understand the aha moments is in our patients' results. Because if we start focusing on why we're here, it's not about us, it's not about chiropractic, but what chiropractic can do, how chiropractic can contribute to a healthcare system that is broken. That's the aha moment for me. And then as becoming president of Parker for over 13 years, I was very excited because I got to see how our schools are working so hard to build the right foundation for the future of chiropractic, to make sure that the students have not only the right knowledge and the skill set, but the evidence to support our claims in the future. Because let me tell you, in the future, you better have your evidence behind what you say you're going to do, because you're going to be judged by many. And then, of course, I got into writing books and got invited into doing television. In fact, this is my fourth book. My first book was Chicken Soup for the Chiropractic Soul. I just wanted to be able to bring our stories to life in a branding that would allow people to recognize the value of chiropractic. And then my last book was The Power of Self-Healing, which with the generosity of FCA and Metagenics, you can all have a free copy at the Metagenics booth, and I'll be there to sign it throughout today. But this book got me on the Dr. Phil show. You know Dr. Phil's been my patient. He said, I can't believe it took you to write a book for me to tell the world what chiropractic has done for me. And that began a whole series of invitations to the doctors and CNN and ABC and CBS and NBC. And all of the shows that I've done, I have my own radio show every single week with Hay House with over 1 million listeners. Fox News just asked me to become their healthy living expert 6 months ago, reaching over 5 million people every week. The reason I'm sharing this with you is because I've learned one thing. My new aha moment is that the public is more ready for chiropractic than we ever give credit to. Here we are in our environments always talking about the challenges and the issues that we're facing. This battle of chiropractic is not going to be won only in legislation. We have to support our associations. We have to give money to our PACs. We have to fight the battles there. But let me tell you, if we can support the patient's needs, if we can listen to what they're looking for in their provider, which is us, we can win this battle a lot faster. So let me share with you another way that I'm doing. I contributed to 3 documentaries this last year. 3 documentaries. Jeff Hayes brought us The Doctor last year, which made a tremendous impact in our profession. Watch this minute of a clip of the next trailer that's going to be launched in a month from now all over the world, and it's called The Curious. And if you can cue it up, I want you to see the impact that chiropractic is going to have in the world.
July of '08. I was told I had a fatal blood disease. I asked what the prognosis was. The surgeon said you need to write a will and find a place for your son to live.
I've never been sick in my life, you know, and here I'm facing cancer, and that was a pretty scary thing to do.
I've seen patients who were told they had only a short time to live, but who are alive and thriving decades later.
What happened in that place where a miracle occurred?
When people accept that there might be another answer, transformation begins to happen.
We've ignored one of the most significant aspects of healing.
When you study the centenarians on this planet, the average 100-year-old is healthier than the American 70-year-old, and there's 30 years difference.
How much genes contribute to the diseases in our world? It turns out far less than 10%.
Science now is overturning some of the deepest truths that have been held for 300 plus years.
Bottom line is we can be healthier. We can even win the war against cancer.
We were intended to be healthy and vital in the world. And if that's not happening, there is a reason.
We are seeing profound healing like we've never seen before.
It's a power that has been discounted since science began.
We are more powerful than we could have ever imagined before.
I can tell you how to get healthy in one sentence.
My doctor said, look at your blood results. And I just broke down in tears because I was going to be okay.
I had no problems and a quick recovery.
Consider the possibility of infinite possibility.
What's considered impossible is just a consensus of outdated beliefs.
The knowledge and the power to alter the course of your health is within you.
You know, I can tell you this one thing. I get more questions about lifestyle than anything else in our question. Thank you. The reason that I'm promoting the benefits of nutrition in chiropractic is the fact that I recognize that that is where the public is at. We got to meet the public in where they're at, not where we are. Right now, the public is looking. Look at the Dr. Oz show. Almost 80% of his subject matter is nutrition. My next books are all going to be about nutrition in the next year. But I want you to understand something. Right now, you have an opportunity to position yourself as the real health wellness provider in your community. And I believe that the aha moment for you, I hope it is, that is by sharing the results that our patients have with as much passion, as much fervor, as much evidence as you can grasp, because right now, science is behind us more than ever. More than ever. We have more scientific research backing up what it is that we do. The problem is that most of us are not aware of what that is. I want you to know that the public is ready for you. My question to you is, are you ready for them? God bless you. Thank you so much.
Antonio, thank you very much. Now we have one final presenter. Ladies and gentlemen, Dr. Tony Ham, President of the ACA. You know, we talk about a lot of other stuff, and, you know, somebody has to do the work. You know, after the meeting, somebody's got to do the work. And the work has got to be done. And Tony, come on up here, because ACA is doing some great work to help try to make us fit into everything. Tony?
Thank you very much. It's really interesting to sit through this plenary session and hear all the wonderful things that chiropractic does and all the aha moments, and I'm thrilled to be here. My aha moment occurred after I was the president of the ACA for a year, and when I took this job, they told me it was a position. And after the first week, I had gotten at least one email per week from Dr. Sportelli, so I said, aha, this is a job, not a position. So I'd like to take a quick moment and just recognize some of the ACA people that work for you in the state of Florida. Dr. Carla Godano is the South Florida delegate, and your honoree this year is Deb Hoffman. She's your North Florida delegate. And please also recognize Dr. Craig Newman, who is actually governor of District 5 for the ACA. So thank you all to these folks. And they're doing a wonderful job on your behalf. I'd like to start my remarks, if I could, by sharing with you an open letter from the American Chiropractic Association to the President of the United States. And I'm going to paraphrase, if you'll bear with me a second. There would be a highly significant cost savings if more management of low back pain was shifted from allopathic physicians to chiropractic. There should be a shift in policy encouraging the preference of chiropractic for most patients with low back pain. All chiropractic services should be integrated into the new healthcare system. The overwhelming body of evidence shows chiropractic management of low back pain is more cost-effective than medical management, and many medical interventions are of questionable validity or are clearly inadequate. Chiropractic management is greatly superior to medical management in terms of scientific validity, safety, cost effectiveness, and patient satisfaction. And I quote from that letter, "We applaud your commitment to reform America's healthcare system and your genuine desire to control costs and increase access to care. For all the right reasons, chiropractic care should be a guaranteed benefit in America's new healthcare system." Other than Dr. Sportelli, I'd like for somebody to tell me when they think that letter was published in the Washington Post to the President of the United States. Anybody got a guess? It wasn't 3 years, it wasn't 5 years ago. That letter was not written to President Obama. That letter was written in 1993 to then President Bill Clinton in his first term of office during the advent of our first attempt at healthcare reform. You remember that? He actually sent me this a couple of weeks ago, so thank you, I appreciate it. I think it puts everything into context. Healthcare reform back those days was called Hillary Care, Managed Care. The point Dr. Sportelli had in sharing that with me, and I absolutely agree with this, is 21 years later, what's changed? We are now once again back in the middle of another healthcare reform, and I agree with his assertion that we keep doing the same things, trying the same things, and expecting different results. So it's time to change what we do. Agreed? I've often said that this is the greatest time in our history to be a chiropractor, except for the 1980s. I wonder if those of you that didn't practice during those prolific years really understands what we lost in that first healthcare reform debate 20-some years ago. Ladies and gentlemen, I believe this profession is at a tipping point. During a conversation I had a week or two ago with a colleague of mine, Dr. Scott Munsterman in South Dakota, we both agreed that we now have the opportunity to make an impact in healthcare that's never been there before with this new healthcare reform called the Affordable Care Act, or PPACA, which basically just involves our potential participation in accountable care organizations like Brad was talking about, and patient-centered medical homes. Yet, we as a profession simply have decided at this point not to embrace this opportunity. I don't quite understand that. ACOs and PCMHs may indeed not be your forte. They may not be your first choice as a model of healthcare for your patients, but believe me, it's clear that integration and clinical collaboration will move forward in this model. It's also clear that as federal and private healthcare dollars dwindle, future payment models will be based on something called the triple aim. If you've never heard this term, get used to it. You're going to hear it again over and over and over again. The triple aim involves cost effectiveness, better outcomes, and patient satisfaction. Is there any doubt in anyone's mind that we excel in all three of those areas as chiropractors? None whatsoever. So we ask the question, why are these federal and state and local and private insurers not beating the door down to bring our expertise to the sick and the ailing people that Dr. Mancini just referred to? Why are they not beating our door down saying, you might help us be the answer to these problems? Well, I think it's simply because we continue to live and work in a predominantly medical market. So we have to change the dynamic at some point. The ACA, through our communications department, has begun to promote what we call a conservative first approach to healthcare. I think we all know that we have patients that walk into our practices that have already gone through the entire gamut of healthcare. They've had treatments, they've had tests, sometimes at great costs, with no tangible health benefits related to that. Then they come to our offices and we say, aha, why didn't you come here first, dummy? So we have to change that dynamic. We have to make sure that the regulators and the decision makers and the politicians and the benefit managers understand that if they come to us first, they're going to get quality care, and they're going to get a lot of times better care that satisfies the triple aim. And I'm going to just move along because we don't have much time, but the bottom line on this is simply that the American Chiropractic Association cannot make this happen. The Florida Chiropractic Association can't make this happen. COXA can't make this happen. In order to succeed in this new model, this new healthcare model, it's up to the doctors in this room, in the field, to make that conscious effort. And it, unfortunately, like it or not, it deals with data, it deals with electronic health records, it deals with quality reporting measures, what I call disincentives to healthcare, because if we don't start doing it in 2015 and 2016, they're going to take money away from us. So it really is important. Frankly, I don't think we're getting the job done. I think we need to do better as a profession. We need to mature and make the conscious decision that this is the right thing to do as a profession and move forward. And because treating under 10% of our population is not tenable, in my opinion. I'm going to just real quickly, I was talking with my good friend Claire Johnson a few weeks ago, and she was doing some collaboration with the ACA, and she said, can you list some of the priorities of the ACA? And of course, all of these are in our strategic plan, but I just want to share just a real quick list, and then I'll wrap things up. Our goals and aspirations and strategies in the ACA include improving interprofessional relations, the image of chiropractic, enhancing professional maturity, promotion of state advocacy. We cannot do this. The ACA cannot function and do our work unless we have a very strong relationship with each and every state organization. And if we all had them like we had with the Florida Chiropractic Association, this would be a better world, believe me. We certainly promote reimbursement parity. We want to get paid for all we do under the Medicare system, and on and on and on. We've got a lot of good hard workers, a lot of volunteers in the ACA. If you're an ACA member, thank you for your support. If you're not, we encourage you to consider what I just said and come join us at our booth, talk to our people. Lou, thanks for having me.
You're welcome. Thank you. Ladies and gentlemen, there'll be a break now. There'll be an announcement at 10:10 and the plenary program with Dr. and Professor Jennings at 10:20. Thank you very much for your kind attention, and thank let's give another round of applause for the speakers, huh?
chiropractors have a chip on their shoulder because for decades they've kind of been this stepchild of healthcare. They've had multiple other specialties telling them that they're not real doctors. They've had their patients being told by their primary care physicians that they need to go elsewhere. So they've had this mentality that they need to storm the castle and fight their way through it. And unfortunately, that's just not working because they spend most of their time fighting within their own profession rather than understanding and unifying and going in a different direction. When we start putting our energy in positive things to be a solution, we actually start changing the culture around us and allowing people to see us as that and use us in that capacity. And that's why in certain states in the country right now, we're having that progress, we're having that change, and things are moving rapidly in favor for the chiropractic profession.
We're focused on the integration of chiropractic into the mainstream of healthcare. And we think that with Secure Care at the table representing the chiropractic industry, there's a much higher probability of success for the profession.
Our goal is to help our doctors be successful with their patients, and to be successful in their practice. And Secure Care does that.
Before Secure Care came on, we had a bunch of great chiropractors, but we didn't really have a unifying force. I think that Secure Care has been that unifying force for the chiropractors in Nebraska.
When you're making business decisions, focusing on your client and your client's best interests is at the forefront of what we do. And we actually view the chiropractor and the state association as our customer.
Secure Care is not doing this to make money off the backs of other chiropractors. We want other chiropractors to be successful like we've had the opportunity to be.
I think a company that will work tightly with the chiropractic community is a rare occurrence, and I think it's an important occurrence for change, and I think the doctors are really thriving for that and need it.
They've been instrumental in teaching me and helping me understand the importance of what we're doing, and they bring